Thank you everyone for joining us today. My name is Sarah Walker and I'm the Manager of Sector Development here at QCOS. I would just like to begin by acknowledging the Yuggera and Turrbal people, the traditional custodians of the land on which I'm on today, and pay my respects to elders past and present. And QCOS acknowledges Aboriginal and Torres Strait Islander people as the original inhabitants of Australia and recognises these unique cultures as part of the cultural heritage of all Australians. I would also like to respectfully acknowledge First Nations people joining us online today, and would also like to encourage you all to use the chat function to let us know which traditional lands you're dialing in from today. So if you haven't attended a social isolation and loneliness community of practice session in the past, the aim of the community of practice is to provide an opportunity to share experiences, resources and learnings on social isolation and loneliness, and also best practice ideas for building community connection. So for today's session, we'll be focusing on social prescribing, and I'm sure a lot of you online today would be familiar with this concept. It's essentially a means of enabling health or community service workers to refer people to a range of local, non-clinical community services. And it recognises that there are a range of social, economic and environmental factors that impact people's health and well-being. So social prescribing schemes have traditionally developed in the UK, but they've since been implemented in many different countries around the world. And there are many different models of social prescribing that are used internationally and also nationally, but they generally involve three components, which I'll just share on the screen now. So the first component is that a healthcare professional or a community organisation refers an individual to a link worker. The link worker is sometimes known as a community connector, a community navigator, for example. The individual and the link worker then engage in consultations to co-design a non-clinical social prescription or a case management plan to improve that person's health and well-being. And then the third component is that the individual is supported to connect with local groups and community organisations to engage in activities or access support that are going to meet their individual needs and goals. So in Queensland, there are rising numbers of social prescribing programs in the community, and they're located at and utilising neighbourhood and community centres. And we're really excited to be joined today by 4 neighbourhood and community centres who are delivering these programs. So we'll be joined by Angela Talon, who's a social prescribing link worker at the Lockyer Community Centre. So the Lockyer Community Centre believes that healing happens through connection, and their social prescribing program is built on that truth. It's their way of walking alongside families as they help them rediscover joy, purpose and belonging through meaningful community-led activities that nurture well-being and strengthen relationships. We also have Sandra Elton, who's the CEO at North Townsville Community Hub, also known as Notch, joining us. So for the last 2 years, Notch has delivered A Place to Belong, which is a program dedicated to tackling social isolation and loneliness in the Townsville community, offering a social prescribing service, delivering social connection opportunities via regular events, activities and social groups. We've also got Evie Skinner, and Evie's a link worker for the Ways to Wellness program at the Mount Gravatt Community Centre. And Ways to Wellness is a free service for members of the community, age 16 and above. And the program connects people to local services to improve their physical and mental well-being. And then finally, we've got Joelle Philippa, who's a social connection worker at Nambour Community Centre. And Nambour Community Centre deliver the Join Project, which is a social prescribing initiative aimed at supporting families with secondary school-aged children with experiencing loneliness or social isolation by connecting them to community. So during the session today, you'll be learning about what social prescribing looks like in practice across Queensland. And our wonderful panelists will be sharing lessons and practical tips when it comes to supporting people through a social prescribing approach, including how they've adapted this approach to different regions and communities. So thanks very much to our guest speakers for joining us today. We're firstly going to start with Angela from Lockyer Community Centre. So Angela, when setting up your social prescribing program, building trust and stronger collaboration between services was a key focus. Are you able to share with attendees some of the steps Lockyer Community Centre took to make that happen, and also what difference it's made for both your program and the wider community?
Yeah, sure. Thank you. I'm really honoured to be here to share the journey at the Lockyer Community Centre. It's a journey that is still continuing, but thus far it's been all about trust, collaboration, and putting people at the heart of everything that we do. The Lockyer Valley is a bit of a unique place. It's often referred to as a salad bowl of Australia because of its rich, fertile land, growing lots of our fruits and veg. It's a very resilient community, which unfortunately has had to rise up and rebuild after more than their fair share of natural disasters in recent years. So many of the locals have often described it as being in a bit of a bubble, a beautiful, tight-knit community, but one that's often missed out when it comes to services and opportunities. What we have learnt is that programs come and go, funding arrives and then disappears, and with that, trust has eroded. Families have stopped engaging, providers have stopped trying, and the cycle continues. So when we started our engagement with our community, we were hearing that families felt like they were left behind and that they weren't seen or heard or prioritised. So when we were given the opportunity to launch a social prescribing program through the Lockyer Community Centre, we knew we had to do things differently. We couldn't just parachute in with a shiny new initiative. We had to start with heart, and we had to listen, and we had to build something that felt like it truly belonged in the Lockyer Valley. So like the other centres participating in the trial, we did begin with a co-design workshop. We had a room full of stakeholders. We didn't just want ideas. We didn't come with answers. We came with questions. And we wanted honesty. The floodgates opened and we certainly got it. People spoke about the lack of services, the fly-in, fly-out outreach models, that social stigma, the cliquey culture that made families feel excluded. And we realised that if we wanted this program to work, we really had to start building trust, not just with families, but with the providers themselves. So that was our starting point. Not a program launch, but a bit of a reckoning, a moment to say, if we want this to work, we have to rebuild it from the ground up. So we've got to work. In this first quarter, we've been asking all the hard questions. So why aren't services staying? Are they funded but disengaged? Are families unaware, or have they just given up trying? We didn't just ask these questions in meetings. We asked them in parks, in markets, over a cup of tea. We listened to families, we listened to providers, and then we showed up. We went to every community event we could find. So we've been to markets, school fairs, morning teas, expos, cultural celebrations, you name it, we've been there. On top of many one-on-one family support sessions, in this first 12 weeks, we've had individual meetings with 35 stakeholder engaged organisations. We've attended 14 interagency meetings and co-hosted or participated in 26 community events. So we haven't turned up with clipboards and agendas, but open hearts and listening ears, and we've become familiar faces. We've noticed that people have started recognising us, waving to us, stopping us for chats. That visibility has really mattered, and we feel it is not just said, but demonstrated that we're here, that we can be trusted, that we're part of the community, and that we want to help. We've also showed up for our fellow providers, and we've attended every interagency meeting we could find. We've been very clear that we're not just here to refer and support families, but we're here to support them as well. And we've heard from services with tiny teams, some working solo, feeling burnt out and unsupported. In fact, we've seen a wave of services hearing about our program and reaching out to connect. So some have arrived at our door overwhelmed and at breaking point, even in tears, and we've offered a listening ear and a gentle reminder that they can't pour from an empty cup, and we've made it our mission to refill it. So we've made it a bit of our focus. On Are You OK Day, we delivered a small pack to our service providers just to remind them to invest in their own self-care. And next month, we're hosting a Gather and Grow morning tea. So it's a bit of a chance for service providers to connect in a different way. So they get to experience social prescribing through a relaxed sip and paint activity. Where we're creating space for genuine connection and a moment for them just to coexist together and simply breathe. We're hearing from providers that they're actually feeling like they're part of something now, that they're enjoying their work, that they feel more personally supported, and that they're committed to staying in our region to support our local families, which is really great. So to date, we've had 5 service providers that have returned to our region that had left. And we're also noticing a cultural shift where many providers that I suppose you could describe were coasting or not performing have started to step up, and they've started investing again in our region, which is really great to see. Some have regular office space in our centre now, and others we've helped find rental spaces nearby. So we've become a bit of a hub, not just for families, but for providers to connect, collaborate and feel part of something bigger. We are collaborating more with school holidays. The programs, we've found families didn't know where to go. So last school holidays, we've partnered with our local library to co-host an event. We felt the ripple effect pretty immediately, and other providers have jumped on board, and soon we had 4 service providers working together to deliver a children's program with 50 participants. That was a huge leap forward from other programs that had previously been run where they were struggling to get 15 people to arrive for that. So this shift from siloed to shared is changing everything. We also know that funding might not last forever. So we are building this collaborative culture as a legacy, something that will outlive our trial, a stronger, more connected service landscape that keeps working for families even when we're not there to lead it. We are moving forward. We're starting a Connect program in January where we will be offering wellbeing focused activities from cooking classes to art therapy and gardening. These sessions will be community led and facilitated not only by our team, but also by local service providers, and creating opportunities for connection, trust building and gentle introductions to services that community members may benefit from. Just as I wrap up, whilst rewarding, I can say that hasn't been easy. We have had some pushback, especially at the beginning. It's taken patience, vulnerability, it's taken time, and it's meant having hard conversations. It's meant showing up even when we're really tired, but it's also meant witnessing moments of magic. So whether that's a child excited about a new activity, a provider feeling seen, a family saying, I didn't know this existed, thank you, or I decided to be brave and leave the house today because I knew you would be here. So I think at the end of the day, this isn't just about programs or referrals, it's about people. And whether it's a mum looking for support or a solo provider trying to make a difference, they all deserve to be seen and held by their community. And that's what we're trying to do in the Lockyer Valley. One conversation, one connection, and one collaboration at a time. Thank you. Sorry, lots of talking.
Thanks so much, Angela. No, that was great. Thank you so much for sharing all of that. And it was really great to hear some of those practical steps Lockyer Community Centre took to have that more collaborative approach. And the result is incredible with, more services coming to the community and staying and utilising your centre as a hub, which means there's more services for families to access. So that's amazing. Thank you for sharing.
Thank you.
Sandra, I'm going to move over to you now. And with Notch being based in a regional setting, so in Townsville, how have you adapted your social prescribing program to fit the local context, and what approaches have helped encourage participation in the program?
I'm just going to share my screen to share some of the impacts that have happened here. As you've mentioned, Sarah, we knew when we started doing this work that we couldn't do a straight social prescribing program because we didn't think it would work in our community in a regional context. And we had a lot of trouble actually finding anything referencing social prescribing that was Australian. And then if we did find any Australian content, it definitely didn't talk to the extra complexities that we face in regional areas. So I'm going to share some of the ways we've been trying to work on that, and we're having a whole lot of impact, which I'm really proud of this program. The team have been doing an amazing job, and I hope we get to continue to share this program with the community. So our program was called A Place to Belong, and it's come out of our neighbourhood centre work. As we know, everybody that's sitting in a neighbourhood centre, we do social inclusion work as part of our day-to-day. But for us, it really amplified after the 2019 floods here in Townsville. So we got thrown into disaster recovery and have been in disaster mode ever since. Our neighbourhood centre, unfortunately, has done a disaster response in addition to all the preparations every year since 2019. So what we saw, though, is the trends that we identified after each disaster was that the mental health needs of our community amplified, domestic violence increased, combine that with the housing crisis and the cost of living impacts. And, you know, it's understandable that our community needed more support than ever to access programs, you know, for all of those reasons. So we developed a place to belong. We intentionally didn't sit it within the social prescribing in our context did not sit within the GP practice. We avoided the health sector because in regional areas we're so connected. We all knew each other anyway. So we intentionally targeted our social prescribing program to community connections. So we have been accepting community referrals and using all of our existing links in community. And we know the clients who are socially isolated initially who are already connected to our centre. So that's where we began. There's a few ways we've done it differently. This is the need, and I'm sure you guys have seen some of these statistics, but this is the information that's been really powerful in connecting and increasing referrals, because something else that was unique to our situation is social prescribing didn't exist in Townsville before we brought this program here. So we've literally spent 2 years educating the sector and the community and potential clients on what social prescribing even is. So, you know, the statistics are alarming. 4.6 times more likely to have depression, people who are lonely or isolated, more likely to have poorer mental wellbeing. And we see all of this. This comes through the door of our neighbourhood centres every day. So how we set up our program to make it different, this is not, we'll skip over that, is with social prescribing, as we've heard, it's a one-on-one case management. We do action plans. We actually had a lot of help from Mount Gravatt because we were involved in lobbying really for the parliamentary inquiry and then participating in that. So when we were successful in our funding attempt, we connected with Mount Gravatt to really help understand what they had learnt, because they'd been doing it for a couple of years. So our intake and our social prescribing was really informed by the work that they had done. But we then had to add in there, we really didn't have much to refer people to that they could get to because of the regional transport issue. I mean, it's crazy. I live in a major regional city, but we're on the northern fringe of that. So we sit in an area called the Northern Beaches, and here the public transport's basically non-existent, unreliable. So for our immediate community, we didn't have anything to refer them to unless we did it. So part of our program design then included social groups. So we had to increase the opportunities for people to participate for free at Knott or around the Northern Beaches community. So we really focused on that. You can see in the write-up there some of the kinds of groups that we've done. This was all co-designed with community as well. So the ukulele group would never have entered my imagination, but that it was actually a suggestion from the local community and is now one of our thriving groups, and they're performing at local events. So who knew? So we also included in our program social events because a few of us have a marketing background, and I knew that we were going to need a lead generator or some kind of feeder mechanism because people didn't understand what social prescribing was. Luckily, as neighbourhood centres, we have plenty of practice running events. So we built into our program, it was actually based on the book Lunches with Strangers by Kaylee Chu. And we've built in a lunch event. So we do one lunch event a month for our social prescribing clients only. And we were also able to carve out a little bit extra in there as another, just an initial way, a soft entry point for people to connect. We do a monthly cuppa chat. And we rotate that around different areas across Townsville, and that allows us to generate some of that funding and connect it back to local businesses. So we've been able to support local businesses as well. This was our paint and sip event, one of many that we've done. And our social prescribing in its form, other than not being connected to the GP and health sector, is fairly standard for what you've described, Sarah. I am going to see if I can share Rosie's story because it's a really great example. I did check the sound, Sarah, so let's see if this works.
I'm a single mother and I stay at home, so I don't have any company. It's really depressing by yourself. And then my girlfriend, she said she comes to the hub, and that's how it all started. She first joined the social prescribing program. So with this group, you brings everybody together and you find new friends, and it's really good for your mental stability. It gets you out of the house, out of the four walls, gets you with people again. Everybody's friendly and everybody's here for the same purpose, to find friends, to have a nice outing, to chat. My depression's like so minimal now. It's nice. And you leave happy.
So that's Rosie's story. We do have a 3-minute video that you guys are welcome to grab off our Notch website, so notch.org.au. We have a 3-minute neighbourhood centre video and a 3-minute place to belong video. And Rosie's one is a great one to share on socials to help educate community on what this thing called social prescribing is. And I just want to really quickly share with you the outcomes. So we are 2 years in now, and the impacts, and these are described by our clients. So this is what we've been able to achieve in the first 2 years: 4,300 different times people connected. That's just the ones we've tracked. 40 plus social events. We're up to 10 social interest groups and a brand new social prescribing service, which has been amazing. And this is what people are telling us it means to them. 81% feel less socially isolated. 87% feel more connected to their community, and 91% have gained new friends and social connections. So it's not just about connecting people with us, we're connecting them to each other, which is the sustainability part of this project. And then this is what they're telling us, just some of the many beautiful lines of feedback that we've got from our clients so far. So I really hope we get to keep doing this, because part of the really powerful work we've done, we've been able to establish a youth group, which is something that's new for the Northern Beaches. And it's an area of 55,000 people, and there's no funded youth services. So it's been really impactful. And we're engaging disengaged kids as part of that. So our program ends in June next year, but we are really looking for ways to continue this really important work. Thank you.
Thank you, Sandra. That was incredible to see those impacts of the program. Again, similar with you, Angela, and what you spoke about, how you really listened to community and what they were wanting to put together that program and really make it work for your communities. So thank you so much for sharing that. Evie, I'll move over to you now to talk more about Ways to Wellness. So Ways to Wellness has been running for a few years now. Are you able to share a bit about how the program has evolved over time and what key learnings or changes have shaped its current approach to social prescribing?
Yeah, of course. I mean, we've been running for 8 years, so it was very hard to condense it in 8 minutes, but I'll try my best. So hello, everyone. My name's Evie. I'm the link worker for the Ways to Wellness program here at the Mount Gravatt Community Centre. I've been in the role for about a year now, but I've worked at the Mount Gravatt Community Centre in various roles. So first as a support worker and then as an aged care manager. What's always really stood out to me about our community centre is its incredible sense of belonging. We've got beautiful programs, social groups and volunteering opportunities, and they create a space for people to participate, give back and feel like they're part of something bigger. When I worked as an aged care manager, actually, I often referred my socially isolated clients to the link worker, and I actually loved hearing the stories that came back about them making new friends, rediscovering their spark, trying a hobby that they used to love doing when they're younger and getting back into it. You could really see the difference, their mood, their confidence, their whole sense of purpose it was phenomenal. And I remember thinking, that must be such a rewarding job, and I'm lucky enough to be that link worker now. There was one story that really stayed with me, actually. It was an older woman that I met who'd lost her husband a few years earlier. She'd shared to me that she had been referred to a respite centre, she attended regularly, but the space wasn't really culturally safe for her because of the language and cultural barriers. She couldn't really easily connect with that group. But it was interesting because on paper, she looked well connected. She attended the centre several times a week. But when we sat down to actually talk, what she shared was she was so lonely lonely in this group, and she was really anxious and distressed when she thought about the idea of, I have to go to this group. It just wasn't the right fit. So we really took some time to explore what truly mattered to her, her values, her cultural background, what belonging meant to her in her life. She shared that she wanted to be around people who understood her story, her language, her traditions, and I focused on her strengths and made sure that she was in control every step of the way. So together we explored different options, and we found this really lovely respite that honored her culture and reflected who she was as a person. So on the very first visit, she actually cried with joy. It was really sweet to see. She kind of she really found the right fit. There was karaoke going on and singing. It was very sweet. I spoke to her later on, and her voice sounded lighter. She'd made new friends. I mean, she said she couldn't remember the last time she laughed, and she was laughing all the time. So she felt a lot happier. And she'd even mentioned it was like a weight had been lifted from her. But pretty much that's what Ways to Wellness is all about. It's about meeting people where they are, listening without judgment, and walking beside them until they feel safe, seen, and connected again. So Ways to Wellness, we have been running for the past 7 years. We started as a local idea born out of community listen, and we became a statewide movement that's changed how we think about health, connection, and belonging. So what started as a small pilot in Mount Gravatt has actually evolved into an evidence-based, community-driven approach that influences both individual lives as well as the broader policy across Queensland. So back in 2018, the Mount Gravatt Community Centre partnered with the Queensland Community Alliance, and we kind of asked a simple but powerful question: what matters most to the community? So we didn't start with solutions, but we started by listening. And over 100 local residents actually shared their experience of what came through loud and clear was that loneliness and social isolation was one of the biggest issues affecting people's well-being. So from that listening campaign, a community-led partnership was formed. That partnership was made from paid groups, Brisbane City Council, UQ researchers, our local state MP, Corinne McMillan, the Mount Gravatt Community Centre, as well as other dedicated community members from that area. So together, we developed an evidence-based model that was inspired by UK's social prescribing approach, but it was shaped by Mount Gravatt's unique characters, its strengths, its needs, and funding was secured through the Department of Communities in 2019. So Ways to Wellness officially began as one of the first social prescribing pilots within Queensland. And this collaboration really reflects community development in action. It's bringing together voices from all levels and hopefully creating a lasting change. So between 2020 and 2024, Ways to Wellness evolved from that pilot initiative. And as part of our funding conditions for that pilot, we did have a comprehensive 3-year external evaluation, which was required by the Department of Communities to ensure the pilot was delivered with robust and evidence-based methodologies. So the University of Queensland, they conducted an independent evaluation over an 18-month period. And I think that was between 2001 and 2023. So they assessed the program's implementation, its outcome, and its impact. And the study was super interesting. So it was pretty much aimed to determine whether social prescribing could improve loneliness and well-being and physical health among Queenslanders. It was a longitudinal study, so we had 63 social prescribing clients with 51 patients who attended their GP frequently. And the findings from that evaluation actually showed that social prescribing supports well-being through 3 key processes. So one is breaking down barriers to social connection, for example, people with social anxiety. Another is helping clients finding belonging, so in groups where they find fit with one another. And then 3 is rebuilding identity and confidence. So that can be very difficult after periods of isolation and disconnection from their community. So you can see Ways to Wellness, we use an evidence-based approach to help its community connect. Its methodology and implementation strategy, it can be relied on. In 2021, we also participated in the Queensland Parliamentary Inquiry of Social Isolation and Loneliness, and this was really heavily supported by our local MP, Corinne McMillan. She was the chair of the Community Support and Service Committee, and she really actively advocated for Mount Gravatt during that Queensland Parliamentary Inquiry. We also had 5 Ways to Wellness clients that were supported by the link worker. They shared their story about social isolation and loneliness. And for many, it was the first time they'd ever spoken publicly. So they were incredibly courageous to be honest about how they were feeling. And that inquiry brought policy discussions. It brought broader community awareness. I mean, we were just speaking to Sarah, who said after the parliamentary inquiry, this is where this community of practice became. So a lot of good things have come out of that. We also kind of worked alongside the QCA with other social prescribing initiatives. Another thing we did was building momentum. So from the parliamentary inquiry, Waste to Wellness also contributed to the Queensland Government Social Prescribing Feasibility Study. And that was actually in response to the inquiry's recommendation. And the government, after listening to that feasibility study, they identified that social prescribing was valuable for our community. It helped reduce future service demand. It helped strengthen capacity and capability across health and community sectors. It supported better health and well-being through a coordinated place-based approach. So you can really see through the research, through the advocacy, through the community partnership, Waste to Wellness has grown into a movement that continues to influence systems, shape policy, and build healthier and more connected Queensland. So again, 2025, we're working closely with the QCA and other funded social prescribing services. We're really kind of hoping to seek a commitment for the current state government to ensure that the funding for social prescribing is included in the next state budget for 2026. It's a collaborative effort. We really want to embed social prescribing in existing fabrics of our community, from urban areas to regional cities all across Queensland. Yeah.
Thank you so much, Evie, for sharing. That was an amazing overview. And I can imagine how difficult it would have been to condense the 8 years of history into just a few minutes. But yeah, really appreciate you sharing the details about the longitudinal study as well. And that really does form an incredible evidence base for the need for social prescribing in Queensland. So thank you so much for your overview. Joelle, I will go over to you now. So your program works with families and teens, and we know that young people aged between 15 and 24 are the loneliest age group in the country. And the Join project does support families and teens to feel connected. Are you able to talk about how Nambour Community Centre have tailored the Join project to meet the individualised needs of young people in a regional context?
Yeah, definitely. So when Nambour Community Centre got their funding and we did all their engagement in the first maybe like 4 months of earlier this year, we asked service and other stakeholders in Nambour community where they saw the gap and how social prescribing could fill that gap with bringing connection and belonging into our community for families. And all the services said that there was a gap with working with teens, and that the statistics are, they're true, and that the services were really feeling that teens were the most isolated, the least likely to connect in. And honestly, Nambour didn't have that much support for teens. I think we all are experiencing a lack of transport across most of our communities. And so for young people to be connected, they have to, in most cases, take a bus. And yeah, that's just a real barrier for people accessing. So we did a team co-design and earlier this year, and we asked the young people what they would like this project to be called, what they want the feel of this project. Is this project that they're interested in having in community? Because we didn't want to make that mistake and just assume that, young people were going to link in with us. And the feedback was, don't make it a project based on loneliness and isolation, but make it a project that's exciting and that people want to connect in with. And so then Join was born. And we have a slogan, come as you are, find where you belong. And so even though the funding is working with families and it is early intervention, we also sit in the Thriving Families team here, which is at Nambour Community Centre, and they work with families with children 0 to 12. So it was just a very natural fit for us to go and work alongside families with teens. So our process working with teens has kind of pivoted over the past few months, because I think, it's a new and emerging project, so we just have to kind of follow where the energy goes. But our process is we do a path. So we are really, we make sure that our process is inclusive, it's creative, it's fun, there's a good vibe for teens. It's not sitting down and finding out, the stories, of course, the stories of loneliness and disconnection is really important, but we want to find out what brings them joy and what matters to them. So through a path, which is a creative visual mapping, our goal is to get 3 achievable goals for them to connect in with. And then from there, we are looking for themes. So with each young person that we're linking in, we're looking for a common theme. So for instance, we had a few young people that wanted to get a job. And so we're collaborating with U-Turn to run RAD resume workshops so that we can support young people to get jobs and link in. We've heard a lot about wanting some coping strategies around mental health. So we've asked Headspace from Richard Orr to come out and co-facilitate some workshops with us around identity and coping strategies. We've done cooking collabs with Emerge Youth in the community. We've held art workshops. We've done cultural workshops with Tribal Link. So what we're really trying to do is we're trying to find, when we're working with the teen independently, we're looking for ways that we can respond to the themes that are occurring. Then over the past couple of months, we've really kind of pivoted our thinking as well. We've kind of moved towards creating teens as the heart of Join. So instead of us doing the path process and then responding to their needs, we actually want them part in the center of Join. And so we've in the process of creating a steering committee, and we're going to have around 7 to 10 young people that are going to help us with shaping what Join is, from everything from doing helping us with flyers and language, which was being so helpful in the beginning of this project, to supporting young people to do an experiment in Nambour that builds connection and reduces social isolation and loneliness. We find that teens invite teens and we get a better outcome. So we really want to encourage that pathway to linking with more teens, and not to make it such a service delivery, a mum or dad or a service has referred, but for young people to be talking about how we can create community change in Nambour that reduces social isolation and loneliness. So that's been a big part of where Join is going in the future. And, young people, when we were doing the paths, a lot of feedback we were getting was, I like to be involved in things, but I don't know how to be involved in things. Or I feel more comfortable when I'm volunteering or have a role than going to a art workshop. And so it just felt like this really natural organic shift to now invite and involve teens to be leading this community change, and actually having community lead the change and not our service provider leading the change from hearing the themes of what we're hearing in individual supports. So we've kind of just pivoted how we do that. And that's been really exciting, seeing young people that, have expressed that they lack confidence, want to be a part of something that brings other teens together through creative workshops or whatever it may be. I do have one case study I'll just quickly share. One of the past, we had this young person like to do anime drawing, and we did an art workshop with a service here, and it was like, to be part of this service, you had to pay to be a part of this creative service, and financial barriers and transport was a huge thing for this family. And when we did the workshop, this young boy fit in so well with the crew that was from the Creative Minds, that the facilitator offered this young person to join the Sunday anime art workshops for free. And even went further, because she was so impressed by his anime artwork that he did at this workshop, that she has arranged another parent to pick this young boy up and drop him back after the workshop. So that just you know, we're really focused on sustainability. We're really focused on when join is, if, you know, we've got a year to do this amazing project, but that those pathways to connections aren't reliant on us, but that we're able to foster and encourage other pathways with other people. So, you know, for this young person, transport is a huge barrier. And just in that one initial workshop, we were able to work out how to overcome that together. Yeah, so that's what we're doing. A lot of collaborations, a lot of hearing from teens, a lot of responding, and then responding with the teens and not doing two. Yeah, thank you.
Thank you so much, Joelle. Yeah, it's what you're doing is amazing in terms of involving teens in every step of the way and co-designing the program with them, and really shows how important it is to get that buy-in for a program to be successful. And appreciate you sharing that amazing case study as well. Thank you. So I've got a final question for all our panelists. And it's just around what some of the important lessons you've learned through delivering your social prescribing program are that you'd like to share with attendees. So I'll start with you, Angela, if you can share some of those important lessons.
Yeah, sure. Look, I think really the most important lesson that we've learned is that trust must come before the impact. I suppose we just wanted to get in there and get cracking. But building that trust was just so important. Otherwise, we wouldn't get off the ground. So that meant showing up consistently, not just with programs, but just being present with patients and a smile. And we've also learned that supporting providers is just as vital as supporting the families. So that when we invest in the wellbeing of our sector through connection, collaboration and care, we create that ripple effect that reaches every corner of the community. So I suppose just realising that social prescribing isn't just about linking people to activities, it's about rebuilding that social fabric that helps everyone thrive. Yeah.
Thank you, Angela. And Sandra?
So we actually tracked quite a few unexpected outcomes. So we were trying to work on the problem of social isolation and loneliness and the preventative mental health space. But what we actually saw was a distinct and now tested improvement in disaster preparedness and resilience right across our community. So for individuals, but also at a community level, because for the first time, we actually had a list of people that we knew were vulnerable, that we knew lived alone often, or were isolated for various reasons. So we were able to check on them before and immediately after every disaster event that's happened since. So that's been really, that wasn't the goal of the program originally, but it's been a really powerful, unexpected outcome and relevant right across our regional communities. So that was one. I think if you're starting out, community education will take time. Like I said before, it's taken us 2 years of educating people on what this thing called social prescribing is, and that it's safe to engage and building that trust. But now we're starting to get the word of mouth referrals, which is what will bring new people in the door. We saw really unexpected outcomes. This really surprised me. We saw antisocial behaviour, believe it or not. So we had the first wave of participants who were coming, engaging, building their own connections, but that actually resulted in some cases in some quite cliquey groups. That was, they started to exclude new people to the program. So we had to really intentionally manage that. And one of the ways, and something that we built into our program to help manage that, was volunteers that we call social butterflies. So you'll see in some of our videos, we like to have it bright and fun. Sometimes they're wearing actual butterfly wings. Sometimes it's just a visual lanyard, but we wanted to overcome that issue of people walking into, you know, for us as well, if you walk into a room full of strangers, it's really confronting. So we wanted to build into our program a really bright visual so that if I could scan the room as a new person, I can see who the safe people are. And what we do at those events is we plant our social butterflies around the room at each table so that we don't end up with a situation of people feeling lonely in a room full of people, because that's totally not what we want. So, and it's actually that it's been an onward referral for people exiting our social prescribing program, because those guys that have been through it are the best welcomers of new people into the group, and, you know, obviously can communicate their story. So antisocial behaviour we did not expect. And for us, we had another unexpected outcome. So I've got a HR background, but it's key to get the right people. Early in the piece, I had to roll over our whole social prescribing team because they were new to neighbourhood centre work. It just wasn't, the people we had hired initially were not a good fit. And I'm really glad we did, because now we've got the right people. But, you know, it wasn't ideal. It, you know, it created some setbacks and some stress across the rest of the team, but I'm glad that we managed that. And the other thing that we found now, 2 years into the program, is that for the sustainability, we've actually pivoted. We've gone into the GP sector now and are being overwhelmed with requests for support from universities, from researchers, from GPs, from primary health networks and the mental health space, because of the problem that exists in the GP sector. So one thing that was really key to embed our referral practice that came through one of our workers was we've worked really hard to get an online referral form. We had to make it easy for GPs to refer. We know how busy they are. So we've actually now got our online referral form linked into the My Health Pathways database, which is the primary database that a GP will access. So if they're sitting with a client and they Google, you know, social isolation or mental health, we will come up on there. They can click a button and send a quick referral to us. So that was something I wasn't aware of, but has been really key in helping GPs connect people to us in a way that's easy to them.
Thanks so much, Sandra. Those are some really great lessons you've shared. I love the social butterflies idea as well.
Me too.
Evie, are you able to share some lessons from your program?
Of course, I also second the butterfly idea. I think that's brilliant. Honestly, I feel like doing this role, I've become really good at wearing a lot of hats. You know, I'm a sole link worker, so I not only provide direct client support, I build the partnerships, I promote the awareness of social prescribing, maintaining the networks, meeting those reporting and funding requirements. I mean, the role, I think it requires a lot of structure, but also flexibility. I think my biggest mantra is trauma-informed approach. You know, a lot of people we support might be experiencing poor mental health, domestic and family violence, financial hardship, grief, chronic health issues, or other forms of trauma from major life changes. So I always kind of have a checklist that I put in my head. I think, you know, am I being trauma aware? Have I been flexible with changes in appointment times? Am I understanding when clients miss appointments or seem less engaged? I try and always kind of remind and recognize that these behaviors, they often stem from trauma and they're valid responses. I also try and work alongside clients at their own pace, and supporting them until they feel ready and comfortable to fully engage. It's the same safety. Have I explained my role clearly? Have I checked in on how clients are feeling throughout the intake through the group? Have I provided that warm referral in the group? Have we debriefed after the group to see what went well, what didn't? I always think trustworthiness as well. Have I said what I will do? You know, consistency is really, really important. Have I provided clear information about privacy and boundaries and the purpose of social prescribing? Choice and empowerment is also really important. I feel like social prescribing and waste wellness, we use a person-centered lens. So have I supported the client to identify their own goals and decide which community activities, support or strategies feels right to them? Strength-based is also really important. Have I focused on what's strong, not what's wrong? Have I acknowledged and highlighted that a client's resilience, resourcefulness, you know, their existing coping strategies? Have we collaborated together? Am I walking alongside them? Are we co-designing the action plan together? So I feel like applying those trauma-informed practices is super duper important to build and maintain those connections. And I mean, we could say the same thing with our referrers. You know, we really want to maintain those connections with our referrers, other health professionals, community groups, just to ensure that what we're referring to the clients are the right supports for them. So yeah, keeping our community mapping and referral networks up to date are really important. They make a real difference in helping people access meaningful activities and reduce their isolation. I've also learned the importance of, you know, having boundaries in this role and clearly really explaining what social prescribing and link workers do. You know, sometimes we do get quite complex clients, or ones that may not quite be suitable for social prescribing. And of course, we do have a duty of care to offer some initial supports and referrals. But, you know, those situations can start to feel a bit more like traditional social work. So having a clear program definition is really important to me. Another important point, I guess, is just, again, like what everyone has said, to share a greater awareness of social prescribing so that it's really integrated within our community, and we probably see less of those inappropriate referrals. I actually went to Europe recently and met a nurse who works in the UK, and she kind of said, in the UK, everyone knows what social prescribing is. Every doctor has a link worker in their healthcare system. So I would just love to see that level of understanding in Australia. Just imagine if every health professional recognized social prescribing as part of holistic care. I just think we would be much closer to the World Health Organization definition of health. You know, health which is not the absence of illness, but complete physical, mental, and social well-being. So it's a holistic approach. Yeah.
Thank you so much for sharing those great tips, Evie. And Joelle, finally for you, what lessons would you like to share with attendees?
I think just being that openness to pivot and to have people's voices at the center of the project. And we've just seen, you know, when we did this, when we started Join, it was based on referrals and having either self-referrals or referrals from other services. And even though people were, you know, very excited about social prescribing in the community, I think the lack of knowledge and just, you know, it was just a bit too much to refer to something that they weren't sure what their clients were going to go through, like the process. And so, you know, we're doing a lot of work with service providers to, you know, educate and let them, to support them to understand. Because I think when we say, no, we're not case managing, they go, oh, well, we don't have time to do this. And I'm like, oh, come back. But so it was, you know, that reevaluating, because it is a pilot project, and yeah, pivoting. And then I think always we're going to do a more developmental project instead of that service delivery model that is, you know, traditional social work. And so we're going to look at it, how we can create community change, and so it's sustainable and lives beyond this pilot project. Yeah.
Thank you so much for sharing that. And thank you so much to our guest speakers today. You've all done an amazing job of sharing your programs and your tips. And I know I've learned a lot, and I'm sure everyone online has as well. So thank you so much. We do have an evaluation survey that we would love for you to fill in, so we can find out how you found today's session. I'll just pop that in the chat. And we'll also send you an email after today's session with some information and links as well. And we'll include some of those videos that Sandra spoke about too in that email. And I also just wanted to let you know that we have the QCOS conference coming up from the 25th of November to the 27th of November, and we'd love to see you all there. It's going to be a really exciting few days. The program's looking great. We've got Rosie Batty giving a keynote session, and there'll be lots of other sessions which I'm sure you'll be interested in. And it's also a great opportunity to connect with each other in person as well. So I'll pop the link for that in the chat so you can have a look at the program and register if you're interested in attending. And yes, finally, thank you all for coming along today. And thanks again to our guest speakers for sharing today. And we hope to see you all at a future event soon. Thanks, everyone. Enjoy the rest of your day.